Hey folks, today is Friday, October 1st, and so happy October. And before I even get into this, you'll notice I have a little congestion, just some allergies. I've been tested. Trust me, I've been tested over the last 18 months, but I do find it interesting. And as we get into today's video about booster shots, because can't wait for them personally, because that gave us a certain sense of comfort over the course of the last 8 or 9 months, and time for those again. So last week, the CDC director did approve booster shots for everyone over 65 and anyone who living in nursing homes or congregate living and certain jobs, and that included healthcare workers. So we're working on it. You all have asked, what are we doing? Here's what we're doing. We are working with CVS, who's our pharmacy partner, to make this happen on site. It will happen on site. The timing is still a little bit of an ish, because unlike in the winter, where CVS would provide the doses and the vaccinators and come in, swoop in, do the clinic and go, we now are going to have to do the actual putting the shot in your arm. So we're going to do that with our nurses and our nurse practitioners. They have to do some training. There's a lot of reading and guidance and paperwork and documentation and such of that nature. Then we have to get the doses from CVS and a certain amount per day. It will all happen. The process is now we're in a little bit of a learning stage, and we'll do that, kind of get through that the end of this week and next week. The following week, we expect that we will do the vaccination boosters for our healthcare residents and healthcare staff. And then the week after that, most likely the week of October 18th, is that when we begin to start doing clinics on site here for independent living residents. So if that timing does not work for you, if you are itching to get out there and get your booster shot, feel free. You can get your booster shot today at Walgreens and Hannaford and Rite Aid and CVS, and they're available. Appointments are available. If you'd prefer to do it here, I want you to know they will be here. We will make that happen. It's just going to take us a little time to get all of the sort of the back end part of this worked out. The other thing I just wanted to mention in today's video is questions that we've gotten about flu vaccine. I think initially the recommendation was have your flu vaccine and your COVID booster 14 days apart. The CDC is saying that that's not necessarily the case. You don't need to do that. You could even get them the same day if you wanted. So totally up to you. We will have our flu clinics happen in our communities in the course of October or so, as soon as those doses are in. And we will have COVID-19 booster clinics for our healthcare residents first, healthcare staff, and then our independent living residents coming in the month of October. More detail to come next week once we can get through all of the training and understand how many doses a day we can get in from CVS and how many we can administer safely. So that's all for today. Happy October. Talk to you soon.